Hello and welcome all in this video. So we are going to discuss about the external morphology of Fasciola hepatica. Fasciola hepatica is an endoparasite which completes its life history in two hosts. Adult Fasciola hepatica is known as sheep liver fluke because it occurs in the liver and bile passage of sheep, which is the primary host. It may also occur in some other vertebrates like goat, horse, dog, ass, ox, deer, antelope, rabbit, elephant, man, monkey, etc. A single sheep may harbor as many as 200 adult fluke in its liver, which is may consequently cease to function normally. This effect is known as liver rot. So the Fasciola hepatica spends a part of its life history in an intermediate host. That intermediate host is a freshwater gastropore. When we see the shape and size of this organism, body of Fasciola hepatica is soft, oval in outline, dorso-ventrally flattened and leaf-like. It is about 1.8 to 3 centimeter long. Width is about 0.4 to 1.5 centimeter. Body tapers away anteriorly as well as posteriorly. Anterior end is somewhat broad and rounded, while posterior end is bluntly pointed. When we see the color is usually pinkish, but the transparency of body wall enables the observer to see the blackish or brownish white line glands along the lateral margins and the alimentary canal, which appears brownish due to ingested bile of the host. There is a particular part which is called as oral cone towards the anterior side, anterior end of body is drawn out into a prominent conical projection called as oral cone, bearing at its tip a somewhat triangular aperture, that is the mouth. Then they are having two types of suckers. There are two small suckers, anterior and ventral. Both the suckers are devoid or lack of hooks and spines. When we see the anterior sucker, the mouth is situated at the center and bottom of cup-shaped muscular organ known as the anterior, or also called as oral sucker. It has a diameter of about 1 millimeter. Muscles of oral sucker radiate from margins of mouth to the periphery of sucker. Oral sucker acts as an ideal suctorial organ, serving for adhesions as well as ingestion. Then second type of sucker, which is called as ventral sucker, which is about 3 to 4 millimeter behind the oral sucker. Situated mid-ventrally is another bowl-like adhesive sucker, the ventral or posterior sucker, also known as acetabulum. It is without an aperture and has a diameter of about 1.6 millimeter. Then body having some apertures like, in addition to the mouth, there are two more permanent apertures on body, a small common genital aperture or gonopore situated mid-ventral a little in front of the acetabulum. A single excretory pore lies at the posterior end slightly towards the ventral surface. Then the body having scales. Body of liver fluke is covered with tegument or cuticle from which project numerous minute backwardly directed spinules or scales. These anchor the body to the wall of the host bile duct, protect the body and help in locomotion. These scales, with the help of these scales, they can attach to the wall of host bile duct. and covering of the body, the cuticle of the body, protect the body of the organism and help in locomotion. So this is all about the morphology of Fasciola hepatica.